According to Hobbs from the Journal of Gerontological Nursing, the estimated average of patients suffering from pressure ulcers is 23% for nursing homes and 30% for hospitals. As a future nurse, my goal is to reduce this percentage and prevent the pain and infection that I've seen many times as a student. I have grandparents just like everyone else in this room. My grandparents are in and out of the hospitals, and like you, I wish no harm to come to them. Long hospitals are never predicted. When they happen, we want the best for our grandparents. Today, I'm going to talk about the dangers of decubitus ulcers, the need for turn teams in hospitals, and how turn teams can decrease the chances of grandma and grandpa getting bed sores from long hospital stays. First of all, why are pressure ulcers so serious? Decubitus ulcers are dangerous for the patient. According to the Mayo Clinic, complications of pressure ulcers include sepsis, cellulitis, bone and joint infections, and even cancer. Sepsis occurs when bacteria enter the bloodstream through broken skin and spread through the body. It's a rapidly progressing, life-threatening condition that can cause organ failure. Cellulitis is an infection of the skin and connected soft tissues. It can cause severe pain, redness, and swelling. An infection from a pressure sore can burrow into the joints and bones. Joint infections can damage cartilage and tissue. Bone infections may reduce the function of joints and limbs. Another complication is the development of a type of squamous cell carcinoma that develops in chronic, non-healing wounds. This type of cancer is aggressive and usually requires surgery. These complications can be avoided by preventing pressure sores. Some preventative measures are keeping the skin clean, reducing friction, and shear forces. According to Eric Fong from the Joanna Briggs Institute, the main method of prevention is repositioning. However, some patients are not able to move themselves. Due to the dangers of pressure ulcers, a better intervention is needed for the immobile patients. The immobile patients can greatly be helped with the implementation of turn teams within hospitals. What are turn teams? Turn teams would be made up of hospital staff that goes through the hospital and turns patients every 2 hours. Turn teams can greatly reduce the incidence of pressure ulcers. According to Becker's Infection Control and Clinical Quality, a university's hospital decreased its pressure ulcer rate by nearly 2/3 by establishing a team that turned patients every 2 hours. The Peninsula Regional Medical Center in Salisbury, Maryland, also implemented turn teams. This cut the rate of pressure ulcers among its patients by more than half in less than a year. Turn teams also reduce the stress level of the staff nurses and the CNAs. According to Kevin Barcelos, turn teams greatly improve the work environment of hospitals. Improving the work environment, in turn, improves the job satisfaction and stress level of nurses and CNAs. Nurses will also have more time to focus on other health concerns for their patients. Even with all of these great benefits, turn teams are not implemented in all of Northwest Indiana. What will happen if turn teams are implemented? That 30% or 3 out of 10 people mentioned earlier would greatly decrease. The chances of your grandparents getting a pressure ulcer would be reduced to almost nothing. Sepsis, cellulitis, bone infections, and cancer caused by decubitus ulcers would also fall. With all of this in mind, decubitus ulcers are dangerous and can be reduced through the implementation of turn teams in hospitals. With your help, I hope to reduce the incidence of pressure ulcers by starting a petition to present to our governor, Mike Pence. I ask you to sign my petition and help me help your grandparents. Thank you for listening, and let's change the hospitals in Northwest Indiana.